Good evening, ladies and gentlemen. Welcome to the regular board meeting for March 16th. I'm going to go ahead and ask Commissioner Almond for the invocation and pledge of allegiance.
Let's pray. Father God, thank you for the freedom that we have to assemble today. Lord, thank you for our country and our leaders, God. I lift everybody, all our county staff up to you, God, and my fellow commissioners, and I pray for our first responders and our sheriff's deputies and everybody who's in harm's way right now. Lord, I just pray that our citizens use discretion with the coronavirus, and I pray that that you would just intervene, Lord. I pray all this in Jesus' name. Amen.
Thank you, Commissioner Almond. Ask for any additions or adjustments to the agenda.
Mr. Chairman.
Commissioner Almond.
Sir, I'd like to make a motion to remove item number 4.
All right, a motion to move item number 4 from the agenda tonight and proceed with the rest. From Commissioner Almond, a second from Commissioner Jordan. Is there any discussion on that? All those in favor, please say aye. Any opposed, no. Motion carries 7-0. All right, item number 1 on the agenda tonight will be Proclamation Child Abuse Prevention Awareness Month, April 2020. Presenter is going to be Ms. Dolly Clayton.
Good evening. So April is National Child Abuse Prevention Month, and this month-long initiative was first celebrated in 1983 after a presidential proclamation as a time to raise awareness about the issue of child abuse and neglect. This initiative encourages individuals and communities to support children and families. During the month of April, all communities are encouraged to take an active role in preventing child abuse and neglect. Research demonstrates that parents and caregivers who have the support from family, friends, and neighbors and their communities are more likely to provide safe and healthy homes for their children. Conversely, when parents lack support or feel isolated, they may be more likely to neglect or abuse their children. It is important for communities to promote the protective factors that have been shown to increase the health and well-being of children and families. These protective factors include nurturing and attachment, knowledge of parenting and child and youth development, parental resilience, social connections, and concrete supports for parents. Child welfare agencies play a critical role in this crusade. The Department of Social Services is responsible for identifying child abuse and neglect, protecting children, treating and strengthening families, and above all else, ensuring the safety and well-being of youth. In Stanley County in fiscal year 2019, which was July 1 to June 30, 2019, our agency received a total of 899 reports of child abuse and neglect. These reports involved 2,126 children. Of those 899 reports, 552 were accepted for either a family or investigative assessment, so that's approximately 58%. To date this year, in fiscal year 2020, our agency has received 655 reports. This is 83 more than at this time last year. Furthermore, these reports involved 1,471 children. Of those 655 reports, 406 were accepted for either a family or investigative assessment, for a 61.98%. We are requesting that you proclaim April as Child Abuse Prevention Awareness Month. In addition to the proclamation, we anticipate planting a pinwheel garden. Our goal is to use the pinwheel garden to transform awareness into action by creating conversations about our responsibility as adults to ensure that all children grow up in a safe, nurturing homes and communities that foster their healthy growth and development. Strong, nurturing communities that are supportive of families can get involved and play a role in preventing child abuse and neglect and promote child and family well-being. So we're asking that you pass the proclamation tonight.
Thank you, Ms. Clayton. Any questions from board members? Not, what's the pleasure of the board?
Mr. Chairman, I make a motion that we approve the Child Abuse Prevention Month as April 2020 and approve the proclamation.
Motion by Commissioner Lawhon, is there a second? Second, I believe Commissioner Jordan was first. Is there any other discussion? All those in favor say aye. Any opposed, no. Motion carries 7-0.
Thank you.
Thank you, Ms. Clayton. Item number 2 is the hot topic, coronavirus community education. Mr. David Jenkins.
Thank you, Chairman, Commissioners. So my goal tonight is to provide kind of a high-level presentation on the most current guidelines and information that we have through public health. So 7 types of coronaviruses that infect humans. 4 are very common, cause mild to moderate illness. Most recently, we've seen MERS, SARS, and now COVID-19. So the latest data from Johns Hopkins University website is approximately 179,073 cases globally, and approximately 7,074 deaths. Again, this is the latest information. This is likely have already changed since I put this presentation together. 98,041 cases outside of mainland China, approximately 3,857 deaths. 4,138 cases in the United States, approximately 71 deaths, and approximately 37 cases in North Carolina, currently no deaths. And happy to say no cases in Stanley County at this time as well. Just go ahead and share that with you. So COVID-19 has a lower mortality rate than other novel coronaviruses. You can see SARS is 9.6%, MERS 34%, COVID-19 is at 3.7%. Keep in mind that can be a little misleading because you're looking at countries like China, Italy, which has a higher elderly population, so there's obviously going to be more impact to some of those countries as compared to U.S. So it'll be interesting to see as this progresses what the actual mortality rate is for the United States. We do have a good healthcare system in place. We've been very preemptive in some of our efforts to try to control this, so we'll continue to monitor that. That mortality rate could change quite a bit worldwide and for the U.S. So some of the testing criteria, this has changed recently as well. Symptoms, fever or lower respiratory symptoms. In this case, cough, SOB for this stands for shortness of breath in this instance. Exposures, close contact with confirmed COVID-19 patient within the past 14 days. Other is fever and lower respiratory symptoms, again, cough, shortness of breath, and negative flu tests if there's an unknown exposure. So how does this spread? How does COVID-19 spread? Between people who are in close contact with one another, 6 feet, through respiratory droplets produced when an affected person coughs or sneezes. When is it spread? People are most contagious when they have symptoms, and the symptoms are fever, cough, and shortness of breath, as mentioned earlier. Can you get it from touching contaminated objects? Possibly if you touch a surface with the virus on it, then touch your mouth, nose, or eyes. That's why it's recommended not to touch your face. And there's been debates about how long it can live on the surface, and it's dependent upon the surface. I've heard 9 hours, 12 hours. I've heard 3 days, so I don't know if there's enough science out right now to really know for sure how long it can remain on an actual object. Symptoms, fever, cough, difficulty breathing, severe illness. We're really trying to put that information out there and share this information with our public members and our stakeholders. What to do to prevent the spread? Wash your hands. Everyone's probably heard that by now. As I mentioned, avoid touching your face. Stay home if you're sick. Avoid close contact with people who are ill. Cover your mouth. We recommend using a tissue or cough in the bent elbow, like that. Throw away your tissues after you use one, and clean and disinfect surfaces very frequently. High risk for severe illness include people over 65 years of age with underlying health conditions. That's an or, with underlying health conditions, including heart disease, lung disease, diabetes, or with a weakened immune system. Caregivers of children with underlying health conditions should consult healthcare providers about whether their children should stay home. So let's stop the spread, and there are actions for those at high risk as well. Stock up on supplies. They're recommending at least a 2-week supply at this time. And it's very evident as we go to our local grocery stores that people are taking heed to this and acting on it. Stay away from sick people, avoid crowds, avoid non-essential air travel and cruises, and stay home as much as possible if there is an outbreak, and especially if there's an outbreak in our community. That's being even about an hour or so, President Trump even recommended, to avoid restaurants and bars. So again, that information is constantly changing as far as guidelines. Now, whether that comes from, that's just a recommendation at this time. There's no ban at this time for any of those implementations. So important that we all take care of ourselves. Let's keep things in perspective. Let's remember that the number of confirmed infections in the U.S. is very low still. Try to unplug from the media from time to time. Get the facts. Let's go to the up-to-date and accurate information from credible sources like Department of Health and Human Services or CDC. Keep connected and maintain social networks to foster a sense of normality, provide outlets for sharing feelings and relieving stress. There's a lot of anxiety and stress throughout our community, state, and the nation at this time. So we got to kind of lean on each other there. Share useful information found on governmental websites with your friends and family. Seek additional help. Consult with a trained, experienced mental health professional when feeling distressed, or support your friends and neighbors. Face masks, this question comes up quite frequently. Currently, CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory diseases, including COVID-19. Face masks should be, however, used by healthcare workers and people who show symptoms of COVID-19 to help prevent the spread of the disease to others. People feel sick, fever, cough, or difficulty breathing and think they have COVID-19, please contact your doctor or local health department, and we've been receiving several of those calls, as long as our local health providers. Call ahead and give a history before going to the clinic, urgent care, or emergency room to avoid exposing others. That's a very key point there. Where can you find current and factual information? As I mentioned, Department of Health and Human Services has a website, links into a lot of CDC recommendations, and the North Carolina Poison Control Helpline or COVID-19 Helpline at 866-462-3821. And I'd be happy to attempt to answer any questions or hear any comments at this time.
Questions from commissioners?
Chairman, I do. David, thank you for the information.
Thank you, Commissioner. I appreciate you getting on the radio the other day and helping spread that information out there as well.
You're welcome. Test kits have been sparse throughout the U.S. from what I hear on the news. Do we have test kits here in Stanley County?
Yes, sir. We do have adequate test kits at this time, and we're told that we, as a health department, can get more from the state as needed.
And
a lot of the, and I add to that, a lot of the private labs are actually providing some of the test kits to a lot of the local providers and whatnot. So,
as far as citizens that are being tested, have you had many citizens be tested?
We
in
are
Stanley County?
we are testing. There is ongoing testing in the county at this time, but I guess the key here is there are no positives at this time.
Could you share the approximate number of people that have been tested?
Technically, due to HIPAA compliance, I'm not allowed to share, but it's just, let's just say it's an ongoing process and a changing number because we have so many different folks testing in the community at this time. Yes, sir.
Any other question?
I have a comment, more than a question, while you're there at the podium. I just want to say thank you to you and your staff, you, Patricia, and Dolly, and Jennifer. I'm on the Board of Health, obviously some of you know, and of course this board here, and in both of those roles, I've reached out to David and asked to be included and kept in the loop, and that added one extra benefit of allowing me to see what they're going through every day. And I only get to see a little bit of it at the occasional meeting, but a round of applause or a sincere thank you is not enough. And it's going to get worse, but what you guys are going through and how you're handling it is amazing. And if there's anything that we can do for you guys, you let us know, because you're at the forefront of this, and it's just intense. So I appreciate very much what you guys are doing and how fast you're able to react to information that changes by the hour.
Well, we've had a lot of support from County Manager Andy Lucas, our Health and Human Services Board, and you commissioners as well. So we appreciate everything you're doing to support us in our efforts as well. So thank you.
Any other comments?
Mr. Chairman.
Mr. Morgan?
I just had one question. I guess it goes on Commissioner Lawhon's question is, as far as the testing, when they are tested, how long does it take to get the results back? Is it immediate, or does it take a day or two?
Excellent question. Yes, sir. It's about 2-3 days out. It just depends on who's actually conducting the test and how fast we can get results. Because some labs are set up that where they're trained and they can do it. For example, Atrium can test through their labs, and some may be shipped off to the state. So, but I'd say a good average is 2 to 3 days. It's a good question.
Anything else? Not. We appreciate the update, David.
Yes, sir. Thank you for having me.
You're up here for item 3.2, the home health budget amendment and consultation.
Yes, sir. As Commissioners, as you may recall, there was a presentation on the current state of Stanley County home health at the board retreat. Seems like it was just yesterday. We discussed several items, key items there. Some were the high-stress environment due to the lack of full-time staff. Since that time, we've lost another nurse and are down to one. The morale impacted by staff shortage and speculation of divestiture was also discussed. A large number of contractors performing therapy, such as physical therapy, occupational therapy, speech pathology, speech therapy, et cetera. The significant competition in the marketplace and the expressed interest in purchasing the county's certificate of need was also discussed. And with this discussion, you recall a majority vote to pursue divestiture. So since that time, I've had an opportunity to speak with several health directors that have been through home health divestiture and asked for their recommendation on how to best proceed with this process. So I've received a unanimous recommendation for using the services of Clifton Larson Allen and Roberts Law Office. And this was due to the fact that their financial feasibility and knowledge of the market to help navigate the process to ensure you as our Board of Commissioners receive the maximum value in terms that you're comfortable with in this process. Our Health and Human Services Board has already approved what I'm requesting this evening, but I'm coming to you all to request approval to move $25,000 from our home health fund balance to professional services in order to contract with Clifton Larson Allen and Roberts Law Office to manage the divestiture of Stanley County Home Health not to exceed $25,000.
Thank you, David.
Yes, sir.
Just one quick, for y'all that came in, I just wanted to make sure you were here for the commissioners meeting.
I'm not sure. We're supposed to be here for
It's like a rezoning.
rezoning.
Rezoning for what end?
For Mearstead Way.
Excuse me?
It's for Mearstead Way.
It's for,
Board of
is it for
Adjustment?
ADR,
Are they meeting
Partnership? They're in the,
ADR 20?
they're in
Yeah.
the partnership room. Yeah.
Oh, what's for?
We just didn't want to,
We should wait.
waste your time.
Thank you. No offense.
That's all right.
Getting a
Sorry
little
about that,
I was
Dave.
getting a little
Thank you.
nervous. Knew something was going on behind me, but
All right, sorry about that, commissioners. Are there any comments or questions for Mr. Jenkins? All right, a motion to approve the recommendation of contracting with Clifton, Larson, Allen, and Aaron Roberts. Is there a second? A second from Commissioner Allman. Is there any discussion? All those in favor of the motion, please say aye. Any opposed, no. Motion carries 6 to 1. Sorry, I have to work on my math. And that brings us to item number 5, the school system budget transfer request. Presenter, County Manager Lucas.
Thank you, Mr. Chairman, members of the board. The school board is requesting to reallocate $500,000 from their capital outlay fund to their operating general fund to cover expenses incurred in the early college programs that they have in school year 2019-2020. There's an attached resolution. And Dr. James is actually here this evening to answer any questions regarding this $500,000 transfer request that you may have. And so I would ask Dr. James to come forward in case there's any questions that the board may have and prior to taking action on this item.
Any questions from board members for the county manager or Dr. James?
Mr. Chairman, I do have questions of Dr. James. A few questions, and these questions are coming as a taxpayer and also as a commissioner. It's my understanding, Dr. James, we have 2 early colleges.
Yes, sir. We receive funding for the one that's on campus at Stanley Community College.
Are they
PRC
both-
code 055, $200,000.
Okay, are they both active at this time?
Yes, they are. We started the new one up, and part of the process of starting a new early college is a very intense application. There were only 2 approved in the state of North Carolina. It's called CIHS, Cooperative Innovative High School Model, and you have to go through a process of approval through DPI. The State Board of Education has to approve it, and then the General Assembly has to approve it for funding. So the second early college, along with Halifax County, there were 2 in the state approved, was approved for funding. We only received in PRC 055 $200,000. In addition to that, typically the principal pay is included, but since the budget has not been passed, it has not come out. It's not been a separate bill. We've actually asked our legislatures to pull it out of the whole budget to resubmit it as a separate bill because it involves us and Halifax County. So a principal pay with benefits, et cetera, is about $100,000 when you look at insurance and, of course, retirement. Apologize, board member. So we do have funding. We got funding just for the early college that's on Stanley Community College. So that put us about $300,000 we were expecting to get from the state short. And I have some other figures I'll be glad to share with you out of local fund balance. I would tell you as commissioners and as a very frugal person and does not like taxes, we have about $5 million local dollars being spent out of our local fund balance, and here's what's happening to us each year. Last year, insurance went up 5%, and retirement and FICA went up 5%. So $500,000 a year is being added to our local budget by the state for retirement and insurance. So eventually, we will not have any local employees. We currently pay for our custodians, our maintenance workers. We have 10 teachers on our local budget. When I got here, we had 63. So next year, we plan on reducing an additional 10 teaching staff off a local budget. So this will not plug the hole we have. We still have a shortage, but I'm working with vendors to curtail the other shortfall we have. But the biggest problem we have is child nutrition is a enterprise fund, and it should be putting money into the local budget. It has not put money into our local budget for 3 years. It is a lost cause. We have turned it around. We've actually seen profitability. By the end of this year, we hope to start pulling indirect costs back from child nutrition, which is anywhere from $300,000 to $400,000 a year. So there's other places we're bleeding. Transportation, we've been spending anywhere from $250,000 to $400,000 a year out of local dollars to supplement transportation because of the inefficiencies. I will say that next year we've already run simulation. We're at 99.8% for the first time in the history of this county. Transportation next year will be under $50,000 out of local budget. So we have a plan to get out of insolvency. We did have a fund balance of $1.3 million, but $800,000 of that's restricted. It's Medicaid and some grant funding, so we cannot, of course, you know, some of y'all were on the board when all that debacle about spending money out of Medicaid for Power Bill came about, and actually we were audited by the state comptroller's office and received a clean bill of health that it did not occur. So while we have a $1.3 million fund balance, only 400 and some odd thousand was available to spend. So I'm just asking for a hand up, not a handout. You get us through this year, we have a much better plan. It's just, here's the other thing, that we're over-identifying special ed students. So the state pays state money up to 12.75% of your ADM for special ed. In addition, we were at 19% when I come to the county. That means we're spending over $1 million out of local fund balance for over-identified special ed students. And I was a special ed teacher, and I believe in services for students that need it, but when you over-identify students, it actually is taking services away from those that need it the most. So over-identification is just about as illegal as not identifying students. We have reduced that number by 163 in 2 years by putting in additional processes and making sure we're identifying based on state and federal regulations. So that's an additional pot of money that we're going to see stop removing money out of the local fund balance. But I will tell you, we're expected to get a hit of $500,000 unless I can reduce the number of employees. And at some point, custodians are a responsibility. The maintenance of the building is local responsibility, and maintenance workers and custodians make up about $2.5 to $3 million. We are doing our best to get all the teachers off the local payroll. We can do that, then we won't have to ask you for this, but just asking for a hand up to help us out on this. And again, we're still not solvent, but by the end of the year we will be. We've cut all contracts for the remainder of the year because with coronavirus, we don't know what all's going to go on. They used to have professional development. No one's going to focus on that at this point. So we have contacted our vendors today. Most of them have stepped up in providing free support from now to the end of the year. So that will help us out some, but we just need this to help us close a gap. And you have my assurances we're working diligently to stop the bleeding. It's sort of like the little boy in the dam. I only have so many thumbs. So we have made some inroads towards cutting some of the inefficiencies out. Again, next year, transportation, we've already run the simulation, will be at 99.8%, one of the highest in the state. That alone is going to save us $400,000 a year out of local. So I'm just, the ox is in the ditch, just need help. Again, very frugal, if any, just like the rest of you, and want to make sure we're spending taxpayer monies as intended. But I'll also tell you that I also had a politician in our legislative breakfast tell us that we didn't cut TAs. Well, I can show you on paper where TAs were cut $1.2 million from 13-14 and 14-15. So the state continues to, I think, push its responsibilities down to local school boards. We'll see how Leandro changes that, but unfortunately, we're trying to catch up. We're trying to herd a group of cats, in my opinion. We're chasing it, we get ahead, then next thing we know, here comes additional money pushed down on us from the state. So, again, just need a hand up, not a handout. This will get us through, and you have my commitment that we're going to do everything we can to be solvent, and we are. We'll be by the end of the year with your help. And again, have a plan moving forward. Some of these albatross that are hanging around our neck, we're trying to deal with those and get us back into the right direction. But when every department you have is bleeding money, it's sort of hard to correct it all overnight. But I feel much better about moving forward than where we have been. We're getting some things under control.
Dr. James, I do have one other question. Or
Yes, sir.
maybe more than one. I know in May of 2019, the school board called for a special meeting with the county commissioners. And the meeting was to review, I believe, capital needs for our system. And at that time, the amount to bring our buildings up to date and be considered well-maintained, or I guess you would say, I would say your wish list was well in excess of $34 million, possibly up to $41 million. The thing that concerns me as a taxpayer, this amount of funds of $500,000 are being requested to come out of the capital outlay fund into the general operating fund to support funding of Stanley early colleges. You told me earlier that you received the $200,000 for the Stanley Community Early College. Why would we not have received the $200,000 for the Stanley STEMS College?
It's tied up in the current budget that has not been approved. We've actually made multiple calls Shaniha Coltrane is over that division, and actually, Ms. Harvey was at the North Carolina County Commission, and actually, I had her pull Ms. Coltrane to the side and ask if we could even get the principal funding. That would be $100,000. And my understanding, she talked to several state officials, and it's tied up in the budget. And unless we can get a separate bill, which right now I'm not sure is going to be on anyone's front plate to do. They're worried about coronavirus. So getting a local bill out to get the $300,000 allocated is probably going to be slim to none. And yes, we have about $41 million in capital needs. Part of that, the state, if we get a budget, in the current budget, if it was approved tomorrow, if it was overridden, we would get somewhere between $12 and $14 million from the state for capital. And then in 2022, we have about $2.5 million coming off from the lottery. So with that, we're around $13 million, which is a huge shot in the arm for the county. And of course, at that point, we would hope to work with the commissioners and see what we can do as far as loans to fix up all of our schools. But yes, we're not an anomaly. All the rural counties across the state are facing the same thing we are. Schools were built in the 60s and 70s by the many factories that were in all the small communities paying in taxes. Those schools are now 50 years old, and everyone that's a rural county is facing the same thing we are. How do we maintain our building based on property tax? It's not possible. So the state actually has done a study. The study's old now, but 4 years ago, the state alone needed $8 billion to bring the infrastructures of schools into current status. That number now is more like $11 billion. So one of the reasons the other party, Democratic Party, was asking for a different way to fund this. But somewhere in the mix, and of course, if it was funded differently, we would get about $20 million for local. So whenever we can get our politicians to decide on a budget, somewhere in the mix of that, we will get a definite shot in the arm, about 25% of what we're looking at to start fixing up our schools.
And Dr. James, I know that you said if the budget passes. If the budget does not pass, and if's a big word, how would you fund the early colleges that we currently have?
So here's the caveat. If we get up over 100 students, by law, the principal's paid for, so there's $100,000 that we would gain. Typically, again, being a projected early college, we should have been funded. And I don't know how it got tied up into the budget. I thought that was a separate bill, but it wasn't. But we'll be over 100 students at the Stanley STEM. We actually had 190 early college applications probably going to accept or eligible for acceptance. About 170 letters will be going out. That college will be over 100 to 125 students a second year, which is phenomenal. The one on campus, of course, will go up. We're hoping with the SCO program, we pulled in some additional ADM dollars, but what it comes down to is 92% of our budget's people. So we're already looking at a reduction in workforce next year of about 8 to 10 people because we are over budget based on what the state pays us for positions. So we're looking already to 8 to 10 positions and 3 administration positions that those individuals currently know we're not replacing them as they either retire or move on. So right there alone is about $900,000 that we would save, plus the additional $400,000 from transportation gets us to $1.3 million. And I'm hoping EC will reduce the additional students that are over-identified by 50 or 60 next year. So we have a plan to stop the bleeding. It's just not possible overnight. Here's the other thing, that the state, of course, with the K-3 class size, started 2 years ago. So they gave us 25% of 33 teachers. Then they gave us 50% this year, but we didn't get this year. So if the state decides we're not going to get a budget, then we'll have to consider if those AMP teachers leave, are we going to replace them? And what we'll do is just shift people around. We generally have about 9% turnover. We have a staff of about 667, so you're looking at about 40 or 50 people either retire. Not a lot of people leave us. A lot of them are retiring, some of the older people, because of the budget woes and stuff. So very cognizant and very appreciative of anything that you guys do for us and want to make sure we're accounting for every dollar. Our books are open. You have our audit report. We submit that to Andy every year. If there's ever any questions on it, you're welcome to ask. I'll get you the answer, but it's just we were in a huge ditch when I got here, and we're still trying to come out while the state keeps shoveling on top of us. And they're not going to stop unless commissioners can convince some people to quit pushing it down to local level. If it continues, I would tell you that locally, we're not going to be able to fund anybody.
Okay. So basically what I've heard you say, Dr. James, is that you're looking for a hand up, and I understand that. But I also I think I heard you say that if we do this, this is not going to be a recurring event that we have to pull 500,000 or approve 500,000 to be moved or shoveled from one account to another.
No, we have plans. Before I'd walk in here and tell you, we already have a plan. We look at allotments, and Andy hit on it, and I'm sure Peter has shoot him many times. ADM funds how many teachers we get, and there is a distinct formula. So if you put less students in a class than what that formula is, it comes out of local budget. And again, when I got here, 63 teachers were paid out of local budget. There's no way to sustain that. So we're down to 10. Those 10 are about $600,000. So as attrition occurs, we'll move those off. Teacher assistants, I mean, you know, everybody's yelling for those, and unfortunately the state did cut us 40. Maybe they don't understand math, but they cut us 40 teaching positions, which was a significant impact on early learning. So we don't know where Leandro's going to take us, but no, my intent is not to be back every year and ask for money. I think I just need a hand up, and we have a plan in place to cut somewhere between 1 and 1.4 million. But again, transportation alone is we're going to gain $400,000 to $500,000 just in transportation. We currently have a budget of about 1.8 million. It's going to be 2.3 million next year, and the percentage is what we draw down that. So we were back down at 71% efficient at one time. So if you got 1.6 million budgeted, you got 70% of that. The rest of it come from local. So there are some talks about, a lot of districts are small like us and do shuttle students between schools because they're small rural schools. And there's been a lot of talk about budgeting for that, so that would also offset some of our costs. But we have a plan. I think it's a solid plan, or I wouldn't be here asking you. I would just tell you we messed up and we need to figure out a way to fix it.
Last question I have for you. Let's say the Senate gets the budget approved before June 30th. Will you receive dollars that you should have received?
I'll receive, well, the early college, I'm hoping if we receive 300,000 there, that would really give us a shot in the arm. And would I be able to put money back in capital at some point? If we move money, we move, there's some things bought out of capital that aren't just buildings. So technology's bought out of capital, so a lot of times we're spending money out of other budgets that really could be under capital. So there is some moving there, but not to this amount. So what we try to do is try to put everything we can building-wise into capital. But again, your technology upkeep, one of the reasons for the quarter-cent sales tax, you know, we gave y'all a figure, it's about $900,000 a year to replenish technology each year. And I will tell you that we're a year ahead of the quarter-cent on getting these buildings up to speed. And as we're doing things, new technology's coming out that we have allocated money to do out of technology budget. So one of the things, and I will tell you this, Bill, we've, Mr. Lawhon, we have applied for $1.5 million safety grant, which I'm very, very confident we have a chance at. There's quite a few of them being offered nationwide through the feds. Normally it's only 50 or 60. This is like 180. I feel very confident we can pull that grant down. If we do, that'll be money that we'll spend on some of the things we have in the quarter-cent sales tax budget already. So we're always trying to blend money and do what's economically feasible. But you can think about $500,000 a year addition into safety in our schools. We can do a lot of things. We just can't hire SROs, but we can do training for the sheriff. And one thing we do, and Andy knows this, we partner with the sheriff. I actually hand the sheriff about a $500,000 check each year for SROs. Then we turn around and hand Albemarle Police Department another $250,000 a year for their protection. So when you give us a budget, really $750,000 is going back out to other community partners. which I'm fine with. I fully understand we've got to protect our kids. But it's sort of money that keeps all of us going. And there's places we can cut there. We're paying 12 months and we get 10 months service. So, we're allowing the sheriff to keep that. I can tell you it's $67,000. It's probably 75 now. But like the sheriff said, keep that for car expense, for training. Unless my board pushes me, then it's a partnership, and he needs that money. And actually, pretty excited because it'll pay for all of his training if we get the grant. Well, I won't say if, when we get the grant. It'll pay for his training. It helps with APD, so it's a partnership amongst all of us. And I will tell you, working with the health department has been phenomenal. I would say Tommy Jordan has been there, and I would think the unison in the room and working together as a team is pretty phenomenal. Doesn't happen always, but through this coronavirus, we fed 5,300 kids a day. We run buses to do that. We're being told that we're going to be reimbursed for that in a special line item, so we're keeping the cost. But we normally feed 4,800. We fed 5,300 a day. By week's end, we will be somewhere between 6,000 and 8,000 meals. So we're trying to be partners and get things out to students. So we are very frugal with your money. But I will just tell you, to be honest with you, not faulting anybody in the past, but the finances were a mess when I got here. And it was a mess in many areas. So we are cleaning up a lot of those, trying to stop the bleeding and be efficient and effective. So absolutely. And this is the worst thing for me to come and do is ask for money. But we're moving money. It's money you gave us anyway, but you're moving it out of a PRC code that's for that. But we are applying for grants to compensate for that. So the $1.5 million we get in the grants, a lot more than the $500,000 we're moving out of capital, and all that will be spent towards some form of capital expenditure and support. So, but yes, and the budget again, without a budget, it's cost us probably $1.2 million. And at some point, I compel county commissioners. At some point, we've got to make our voice heard at our state level. Talking to some of our officials, there's more than $1 billion sitting on hand unappropriated. There's $2 or $3 billion. Then there's a rainy day fund. Well, I think our kids deserve better than this guesswork we're trying to do to run systems. But Johnston County, one of the biggest counties in the state, $8.5 million in the hole because of the budget shortfall. So it's across our state. It's, I'm trying to get us out solvent at the end of the year, which I think I can do. I've got some more cutting to do. But this will help us over the hump, and again, understand our buildings need some significant repair, and that's something that we both talked about. That at some point in the future, we've got to talk to sit down together as both boards and look at the future of Stanley County schools and decide where we need to put things. So, Andy and I have had that conversation. So we're working on a plan to hopefully get the boards together and start looking at the future, because we do need some. You can always remodel an old home. And I will tell you, the architects are saying the worst time ever to build is right now. You will pay an absolute premium. So you can remodel homes, you can make new facades, you can add a competition gym to our high schools, a lot of things without spending $100 million. So again, so that's where we're at. I'll stop talking.
Dr. Jones, I appreciate you answering my question.
Thank you. I'm transparent and I always try to be honest. If I've been, if I find anything different, I'll let you know. But I'm just telling you, PRC codes, we know what we get in each one of them.
Any other questions from board?
Yes, sir. Dr. James, quick question for you. I don't want to get down the weeds in this, but you said 250 to 400K, and that you're having to supplement inefficiencies at the transportation department.
Yes.
Can you elaborate on that a little bit and why we've gotten to this point?
You have an efficiency rating, and don't know how far back in the day, but as much as 5 or 10 years ago, the efficiency ratings might not be 10 years ago, but we can go get the trend data. The buses are really, and I've had to learn all this, so I've had to learn a lot. The closer you can get to 100 students on a bus, so they don't hold 100, but the closer you get to 100, the closer you are to 100%. So the way you get to 100 is run that bus to multiple routes. So if I pick up 50 kids in one route and go pick up another 50, I'm 100% efficient. That's how they figure bus efficiency. Also, parts cost, maintenance, scores are all figured into your efficiency formula. We have asked for that, and the state will not share it. It's sort of like the EVOS score for accountability. They'll just say, here, there's a formula, but nobody will share it. But when I got here, we were at 71 or 72% efficient. The budget then was $1.6 million overall, so you got 70% of that. So that gap had to be paid out of local. And so we have got up to, our recent efficiency was 96% this past year. So we're drawing more state money down. So we knew by going to full-time bus drivers that we would incur some additional costs, but next year it's picked up 100% by the state. So our budget's actually going to go from about 1.67 to 2.3 next year. But 99.8% of that will be sent down to us, and we won't have to make up. It'll be less than $50,000. But over time, it's a huge formula. It's something you got to constantly work on. You got to look at routes, and I think your grandpa was someone in your family. He could tell you, you got to constantly look at routes. They went to Tim's, and I'm not sure if your grandpa was doing it before Tim's or not, but Tim's is an automated system at the state, and you have to put all your bus routes in it. It calculates efficiency for you. So it'll tell you if you're inefficient and how to change routes. It requires a lot of work. And again, we use that with the staggered bail times, which some people don't like, but without that, we couldn't get to 100% efficient. As a matter of fact, we couldn't continue to sustain out of local budget what we're spending, because our efficiency rates compared to other counties and goes down. So if they get more efficient, we also have to get more efficient. So that's what's hurt us in transportation. And again, EC, I've never really been in a county that's 19%. That's huge. Typically about 14% is average. We'll be over-identified, but not by 6 or 7%. That's just extremely high. And again, that's additional funds we have to pull out of local. So we are working. We have improved in every area, which in child nutrition, we were down at 20% for breakfast. Nationally is about 30%, and lunch is about 65%. We're at 50%. We've been reporting between 30 and 32% for breakfast the last 2 or 3 months, and we've hit 60 to 62% for lunch, which is a huge amount of money. So again, if we have to carry a balance of over 1 month, can't carry a balance over 3 months. If it gets to 3 months, she spends it on equipment or whatever. But if we end the year between, if it's 2.5% to 3%, I can pull down anywhere from $300,000 to $400,000 from that and put it into local, because they're an enterprise. It's basically like charging them rent, but I can't charge them rent if they're broke. And the flip side of that is, if they don't make a profit, we have to take money out of local and supplement their loss. All federal laws, and it's just crazy. But I hope I answered all your questions. Anybody else?
Commissioner Barbie?
Yeah, Dr. James,
Yes.
how are we faring collecting our fines and forfeiture money from the state?
We, Mark Louder does that for us, and here's another odd thing, and Andy and I have had this conversation way back. There's been a lot of other fish to fry. In Montgomery County, much smaller, fines and forfeitures were around $375,000 to $400,000 a year. Here in Stanley, they're about $200,000. I've asked, I've got multitudes of pages of printouts, and it has $14 million on it, but I don't know how you figure what we get out of that. And I have asked Mark several times. It sort of seems odd that Stanley County, much larger, gets less fines and forfeitures than Montgomery. I have yet to get anyone to explain that to me. So I don't know if...
I understand it's supposed to be per capita, the number of students is the percentage we're supposed to
Yes,
get.
and they're at 4,000 and we're at 8,400, so we should get twice of what they're getting, and we're getting half of what they're getting. And again, I've asked Mark and I've looked into it with the clerk of court. They've run me spreadsheets. I know what the total amount of money is in fines and forfeitures, but again, that's one of those formulas nobody will hand you and say, here's how you calculate it. So I personally think we're about $200,000 a year short in fines and forfeitures. The state, of course, owes every school system $735 million that the courts have already ruled that is our money and should be distributed, but I'm sure that's been long spent. And again, there's a lawsuit, and I think we're part of it, as every county is, but it's money that's owed to us through fines and forfeitures that we're not getting. And I would tell you, if we had that shot in the arm, it's for technology, that would take all the technology out of the capital budget and give us another shot in the arm to work on some schools. So.
Any other questions or comments from commissioners? Seeing none, how do you wish to proceed with the resolution?
Chairman, I'll make a motion that we
Motion to approve the resolution as presented here from Commissioner Lawhon. Is there a second? Second. Second from Commissioner Morgan. Is there any other discussion? All those in favor say aye. Aye. Any opposed, no. Motion carries 7-0.
Thank you,
Thank
Chairman.
Dr. James.
Thank you. Thank you, guys.
That brings us to the consent agenda. Are there any questions about the consent agenda? If not, is there a motion to approve the consent agenda? Motion to approve from Commissioner Jordan. Is there a second? Second from Commissioner Allman. All those in favor say aye. Any opposed, no. Motion carries 7-0.
Mr. Chairman,
Commissioner Morgan.
I'd make a motion that we cancel our board meeting for the first week of April and go to just one board meeting in April, which I believe is the 20th, as of now.
So Commissioner Morgan has made a motion to cancel the April 6th board meeting, which was on the calendar, and hold one meeting in April, which would be on April 20th. Is there a second? Second from Commissioner Jordan. Is there any discussion? All those in favor, please say aye. Aye. Any opposed, no. Motion carries 7-0. Brings us to public comment. Nobody signed up. Is there anybody that wishes to speak? Seeing none, I'll proceed to board comments, announcements, and committee reports. We'll start with Commissioner Lawhon.
This is an announcement. I guess I should ask you this while you were up there, Dr. James. I understand, all the schools in North Carolina are closed. And I know that locally the staff, I think, are still coming to school. If that continues on, and I don't know what other counties are doing, will the staff, and when I say staff, I'm talking about everybody that works for the school system, will they continue to get paid even though they may not go to their work location?
According to the governor, we've had, it's amazing, that Friday at 3 o'clock, we shouldn't close schools down, but then at 4:30 Saturday, we should. So I haven't figured that one out yet, because we were told Friday, the worst thing we could do Friday at 3 o'clock was shut schools down, then 4:30 Saturday, we were shutting schools down. Our staff actually met yesterday to put a plan together, and I will tell you that Union County called us to say, how did you do what you done today? We want you to walk us through it. So Union County did not serve kids today meals, nor did Cabarrus, and we constantly get compared to them. But the state has said that if you're on state pay, you will continue. So our board is meeting to get a resolution from my board to say, if you're on local pay, I would like for you to agree that local paid people will continue to get paid. What we've asked our paraprofessionals, and because what's going to happen, we were preparing 4,800 meals. I need more hands on deck to prepare 6,000 or 8,000 meals. And it's not just our kids. Any school-age kid in this county walks up and wants a meal, they get a meal. We're under a summer feed program, which the feds will reimburse us for. But again, I have a PRC code for the yellow buses. We were told we reimburse for yellow buses, so we're keeping all that separate. So we are delivering meals to bus stops throughout the county, and we'll continue to do so. Faith-based people have been calling me all day. It's a little bit more complicated. If they come pick up, it's easier than me taking to them. They have to be trained if I drop it off at a church. So I work with them this week, but our goal would be to feed, it doesn't matter if they're Greystone, who cares? If they're a child school age, we want to feed them. So we need some additional people to help us pack stuff. They can't prepare food, but they can help pack it up, get it on the buses. So we've asked that all of our buses have 2 additional people on them, so our paraprofessionals can help there. And the governor did call off schools. I had to remind some staff for kids, not adults. So we don't want to congregate, but again, in a school building, as long as we're separate, we're not doing professional learning communities, we're doing everything virtually. So Wednesday, we will have a remote learning plan sent home with our kids. The board approved 2 months ago remote learning, so I'm thinking we have met the law. Our kids go 1,025 hours, that's the minimum. So with this remote learning, as long as teachers are logging, we have that ability, logging and kids are, then we come to the end of this and they say, well, we still gotta do the 1,025. Our kids would have got instruction and not have to go on, because extending school 2 weeks is gonna be millions of dollars in the state. So I would think it would be waived as an emergency situation, but if not, we put a bunch of stuff together. Wednesday, we'll have drive-by lines, and we'll start delivering it by buses to homes. It'll be packets for K-5 delivered, so we had a good plan we've been working on for about a month. So we were sort of ahead of the game, but we were doing it for other reasons. So, yes, we plan on paying everyone.
Okay, thank you for that. And I would like to thank the educators and also the healthcare people that are working hard to try to do the things that they need to do in a time when nobody knows what's going to happen in the future. And I appreciate those professionals. Thank you.
Thank you, Commissioner Lawhon. Commissioner Jordan?
Nothing for me at this time.
Thank you, Commissioner Jordan. Commissioner Barbie?
I want to ditto what Bill said about thanking the health department and the education. This time of panic, everybody's in a panic mode. I just pray that this thing ends quick, that God has mercy on our county education system.
Thank you, Commissioner Barbie. Commissioner Furr? Thank you, Commissioner Furr. Commissioner Allman?
Just like to reiterate what Mike and Bill said about the local school board and the folks who are working in our educators. My wife was working Saturday preparing stuff for the kids this week. She's a school teacher out at Oakburn. I know a lot of the other teachers around the county work too, and just want to know we appreciate them.
Thank you, Commissioner Allman. Commissioner Morgan? Thank you. I'd like to reiterate the comments before me about the work that the health department is doing. I know that they are well trained for it. I would like to thank Jennifer. She happens to be here tonight. She worked on Saturday. I ran into a young lady that needed some assistance and reached out to Jennifer, and she responded late Saturday evening. So I don't know what the outcome of that was and don't care to, but you know, I appreciate you responding back and helping out where you could. The schools, you know, I think it's going to be an interesting event. I sat through meetings today in my school district, and I know Dr. James is having the same meetings here, and I think it'll be interesting. I think kids, you'll probably see kids out and about because they don't understand the impact of this or the reasoning behind it maybe. And in some cases, we have adults that don't understand the impact of this and the reasoning behind some of this that is going on currently. And a lot of it is fear-based, just fear of the unknown or fear of whatever. But I do encourage people to reach out to the CDC site, the North Carolina Department of Health and Human Services site, for accurate information, not information that gets taken out of context by CNN and various other sources. You know, I do hope that you'll look to those sources for accurate information and use that to better your judgment. But other than that, that's all the comment I have tonight. If there's no other business, I'll seek a motion to adjourn. Motion to adjourn from Commissioner Morgan. I thought I heard a second. Second from Commissioner Barbie. Is there any discussion? All those in favor say aye. Aye. Any opposed? No. Motion carries. We'll reconvene on April 20th.